Our quality improvement project is on Clostridium difficile, presented by Jasmine, Nisha, Ashley, and Joseph. Clostridium difficile, also known as C. difficile or C. diff, is a spore-forming gram-positive bacterial infection that remains a common and persistent hospital-acquired issue, which has led to increased rates of morbidity, mortality, and overall healthcare cost. C. diff most commonly causes antibiotic-associated diarrhea, colitis, and life-threatening conditions, and is a spore bacterium with a long lifespan, which can live on surfaces for months, causing increased transmission from person to person. According to the American College of Gastroenterology, the most common risk factor for C. diff is the inappropriate use of antibiotics, along with other factors such as old age, compromised immune systems, and a long-term hospital stay. C. diff is a large clinical problem as it infects about 500,000 Americans annually, and among those infected, approximately 29,000 patients result in mortality within a few months of diagnosis, of which 15,000 deaths can be conclusively associated with bacterial infection and no other cause of death. Annually, approximately 1 in 6 patients who are infected with C. diff will contract it again within the next 2 to 8 weeks, and about 1 in 11 people over the age of 65 is diagnosed with C. diff and dies within 1 month. Additionally, infection rates negatively impact healthcare costs, as C. diff has caused an additional $1.5 billion increase in hospital spending.
Okay, so here are our evidence searches. The first of which is the Agency for Healthcare Research and Quality, or the AHRQ. They developed something called the Antibiotic Stewardship Program with the goal of reducing microbial resistance and decreasing bacterial transmission caused by multi-drug resistant organisms. The focus of this was to select appropriate antimicrobials, as well as the dosage and duration, while keeping toxicity to a minimum and resistance to a minimum while still being effective. Besides that, we also use the American College of Gastroenterology. They focus on using narrow spectrum agents as directed and avoiding unnecessary use of broad spectrum antibiotics. They also talk about the importance of hand washing with soap and water, not the use of alcohol hand sanitizers, as well as the importance of the proper use of PPE. And then here we have our SMART goals. So these really do align a lot with the antibiotic stewardship program. And the aim for our project is to reduce the rate of Clostridium difficile infections in the hospital setting by at least 10% by May 30th, 2023, with the use of interventions developed by the ASP to improve patient health outcomes and to decrease preventable hospital expenses.
Okay, so the team members that are included for this project are the epidemiologist who study infectious diseases and determine what strategies can prevent or contain the spread of disease. They identify the distribution of diseases, the factors that are underlying their source and cause, and methods for the control. The next member is the nursing staff who are responsible for identifying patients who may have C. difficile. They collect samples and implement interventions. We have the infection preventionists who are responsible for the facility's activities aimed at preventing healthcare-associated infections, or HAIs, by ensuring that sources of infection are isolated to limit the spread of infectious organisms. The operation managers, which is an important role to lead the team and ensure that tasks will be completed. And lastly, but not least, the environmental services personnel, who is responsible for the facility's safety and cleanliness by utilizing strategies that effectively decrease the transfer of infection from the environment to patients and healthcare staff. Over here, we have our fishbone tool that we used. We see that we identified 6 categories that are responsible for the increased rates of mortality and overall healthcare costs due to infection of C. difficile in healthcare setting. These categories include ineffective contact precautions, poor hand hygiene and sanitation, improper use of PPE and disposal of soiled material, and inappropriate use of antibiotics. The common causes within these categories are absence of information, education, training and technique, and non-adherence to facility policy.
So this team will be measuring the number of cases of C. difficile that are contracted during patients' length of stay and comparing that to previous case rates. We want to reduce the incidence and rate of the infection. We will be using sources from CDC, which is the Infection Tracking and Surveillance Program, as well as using the National Healthcare Safety Network. We will be tracking the infection quarterly and also contributing our data to the annual data. So the expected outcomes from our measures and methods would be to reduce the rate of C. diff in the hospital setting by at least 10% by May 30th of 2023, and to improve patient outcomes by reducing the mortality rate caused by C. diff. In addition, we would see reduced microbial resistance, providers selecting appropriate antibiotics, which includes the right dose and how long they will be treated for, and also reduced expenses for the hospital and the patient. So the implications for practice, the next steps would be to review, audit, and give feedback about the antibiotics used by the patients. We would want to see what their health outcomes are and the use of broad spectrum antibiotics. We will continue to monitor the results by using the strategies and interventions because they are meant for long-term use. And we want to increase staff and patient involvement in prevention interventions of the infection. By doing this, these expected outcomes, again, would be to reduce microbial resistance, selecting the appropriate antibiotic to use, improve patient outcomes by reducing their hospital length of stay and reducing the spending, so like the cost of treatments or including with their length of stay at the hospital. And here are our references.
Thank you. That's it.
Thank you.